gown out here if we decided to use a gown, but this is not going to be an undressing kind of exam. So whatever you're wearing to school that day is what we will have, with the possible exception of shoes. Now, we did take the shoes off. So first we start out with the skin. We inspect the hair, the skin and the nails. We're looking for irregularities. We're looking for skin defects on the scalp. We're looking for lesions. We're looking for trauma. Anything that does not appear right. As far as skin temperature goes, we're checking for temperature and moisture to make sure that it's symmetrical. We're looking for edema. There should not be any edema on the scalp. We palpate the forehead. We palpate the face. Again, we're just checking for symmetry, for temperature, for edema. All those things, and you can say that once and you're done. You don't have to say it several times. We like this to be head to toe, so we want it to be organized. Next, we're going to palpate the head. Now, when we inspected the scalp, we also inspected as the head, so you don't have to redo that. We're going to palpate for symmetry. You want to look for deformities of the skull. You're palpating for irregularities in the ears and the nose. Make sure everything is symmetrical from one side to the other. Inspect and palpate the sinus areas to make sure that there is no pain. And if you palpate those, the patient should not complain of pain when you do so. Palpate the TMJ, temporomandibular joint. We're testing cranial nerve 5. And how do we do that? And we have the patient push their hand or their head against our hand, and we have them clench their teeth together. And cranial nerve 7, same thing. Auscultate and palpate the temporal arteries with a stethoscope. And the temporal arteries, remember, we're listening for bruits. A bruit is that sound of constriction. If the artery is constricted, there's a stenosis there that as the blood pushes past it, there will be a gushing noise.
And do you remember which side of the stethoscope you use?
No. Use the bell.
Yeah, because it's a musical sound, that's what I always say.
That's a good way to remember.
Yeah.
Okay, that completes the exam of the head. We're going to move to the eyes. And with the eyes, we're going to start with visual acuity.
One eye, both eyes?
We're going to do both eyes.
Okay, both eyes together, about 14 inches. And if you can read from the bottom line that you can see. 14.79.
Now, in the process of doing this for the lab, what you're supposed to do is check one eye and then check the other eye and then check both eyes. For the expedient, this is just a gross evaluation, so for the purposes of the test, we're only going to have you test both eyes. Not one and then the other and then both.
Do you know what you use this for, to test what kind of reading?
And you're going to want to document the findings.
Starts with a P. Do you know the medical term? Presbyopia. Yeah. See, and you thought I didn't know anything.
Well, next, after we finish visual acuity, we're going to test visual fields. Yeah.
And then you go straight ahead, and then follow my finger with your eyes, but don't move your head, move your eyebrows. Oh. Don't move your head. And then do you count 8?
Yeah. And then we're going to check. Everybody all right up there?
Yeah.
Okay. Actually, I'm used to that sound. That's what happens when people pass out. You hear a clunk somewhere. It's what we do. All right, so we're going to look for alignment, visual alignment next, and then the 6 points, 6 cardinal points of vision.
So alignment. Look straight ahead.
Remember when you flash the light on the eyes, where's that dot supposed to appear?
Center.
Same spot on both sides, right? And then the 6 cardinal points of vision. Oh, you did that? Okay. Pupillary response. We're gonna inspect and palpate external structures. Now this is a little different than we were palpating the face for skin integrity. This is, what you're palpating here are the orbits. So this is the eyebrows and the orbits, a little bit different. All right, we move on to the ears. Inspect and palpate external structures. We're going to test gross hearing.
Okay, then I need you to take your pointer finger on this hand and put it in your, did you have tragus or in your ear?
Just in your ear.
If you want to
Make,
put
and
your left
wiggle
ear,
it, make a little noise.
yeah, make a little noise. And then I'm going to say 3 things behind you, and then I'm going to whisper them, and you can repeat them, that'd be awesome. So yeah, wiggle that at the same time. 1, 2, 3. All right, great. And then you got to do the other side, because you have 2 ears, as far as I know.
Yeah, test both of them.
A and C. All righty. She can go see here.
We move on to the nose. Inspect and palpate external nose. And inspect internal structures.
And then I usually.
And we're just going to peek inside with the otoscope. And we move on to the mouth. Inspect and palpate the oral cavity.
And did you have them pull down, or did you have them tongue depressed, or what kind of?
Just the tongue depressor. Yeah. Inspect the palates and the tonsils. And now we are also testing cranial nerves 9 and 10 here.
Awesome.
Cranial nerve 9, as you say, 10,
Gag them.
you gag.
If you don't like your patients,
Yeah.
that's not, but.
Assess the tongue.
And then you can stick your tongue up, and then up, like, yeah, there you go, so.
Inspect and palpate the lips.
I don't have gloves, so we're gonna pretend.
Yeah, we take that for after that look. And we move on to the neck. We're going to inspect and palpate the trachea and the thyroid. That's going to be hard to do because of the tape.
Yeah. And then if you can tuck your chin just a little bit and go to the right, and then swallow.
And we'll move back around. That's the thyroid. We'll move back around the front.
Go the other way.
Palpate the lymph nodes.
Other one. And lymph nodes. Preauricular, do you have to name them all?
No.
Okay.
You just have to palpate them. I expect you to name them.
Oh.
Now, it's helpful when you're doing lymph nodes if you can say, I'm doing the preauricular, I'm now checking the posterior, I'm checking the anterior, because that's going to help you to remember what you're testing. But don't get all worried if you forget the name of a set. That's not going to make any difference. What I'm interested in is that you know to palpate them and where they are. If you can't remember what to call them, I'm not worried about that. Lips, trachea, thyroid, lymph. Okay, cranial nerve 11.
Can you shrug your shoulders up, put them down, shrug your shoulders again, fold them, don't let me push down. All right.
And that completes the neck. We move on to the respiratory evaluation. So we're going to start by inspecting the thorax, posterior, lateral, and anterior. And what we're looking for is symmetry while the patient's breathing. We're going to be looking for differences. Remember that normally the patient would be ungowned at this point. So you're looking for skin color, skin texture, you're looking for edema, you're looking for abnormalities of the chest wall. When the chest wall, when someone takes a deep breath, you want the chest rise and fall to be symmetrical, and you're going to look for that. Assess respiratory expansion.
Do you do it anterior and posterior you're doing, or what?
Yeah, it should be NP. Posterior first, then anterior.
Oh, I backed it up, sorry.
And remember, you're putting your hands on the chest wall, the patient takes a breath, and your hands should move apart.
Yeah, there you go.
Palpate the thorax systematically, posterior, lateral, and anterior.
It's okay to do them together.
Yep. If you want to do them together, you can. Again, you're looking for asymmetry. You're looking for, they should be symmetrical side to side and also front to back. Chest rise should be equal front to back. So if the patient takes a breath, you should see chest rise in the front and in the back. Tactile fremitus.
You want to do both front and back?
Yeah.
Okay, so every time you feel me touch, if you can say, are you using 99? Okay.
You guys all said 99 in your labs, right?
You can even go lower than that.
Anybody say 98?
Yeah, there you go.
99, 99, 99,
Yep.
99.
Good. Good. That way. Okay. And then,
99, 99.
and then now you have to move the girls out of the way. So usually what I have to do is pull your bra straps up. So then that gets them out of the way. And then,
99,
yep,
99,
yep, right there.
Auscultate the lungs, posterior, lateral, and anterior.
So, yeah, I'm a fun lab instructor, so. Okay, big breath. Every time you feel the stethoscope touch it, you can take a big breath into your mouth and out. Do you want to start from bottom up or top down?
Top down.
Okay. And then if you can do the same thing with the girls, yeah, right there. Then you must, can you swing your legs around and do the posterior? Yeah. There you go.
You could start at the bottom and work your way up. I prefer top down because it allows me to be more systematic. And we already did the anterior. Good. Oh, beautiful. Now auscultate one voice up, posterior, lateral, and anterior.
Which one do you, how about 99? Can you go across these? Okay. Yeah.
99, 99, 99, 99, 99, 99, 99, 99.
And then, oh, yeah, switch back. Around again.
Okay, next we'll do cardiac
99.
assessment.
99.
Oh, we're doing the-
Sorry.
99.
Okay.
99. 99.
Yeah.
99.
All right.
Now we're gonna do cardiac assessment. Now, in the first test, you're gonna look at jugular vein distension. For this, the patient needs to be at 45 degrees. So we're gonna kind of take that. I brought a couple pillows down, but there's no way to elevate the bed beyond that. We're gonna pretend she's at 45 degrees here.
All right. So then if you can chin down a little bit and then to your right. And then,
What are you looking for here? Jugular vein distension, right?
I need to, so remember you have how many? So
So
you
you
have,
have two jugular veins.
yeah, one on each side. People forget about that. And they look, your neck looks marvelous.
Now, we don't expect you to do the measurement, but you should be familiar with it. So what we're looking for is distension here, but remember that if you were going to measure that, let's say you did see it, we're taking the time out here for a second. You're gonna take a flat bed and you're gonna go from the sternum at 45 degrees, you're gonna go from the sternum over, and then you're gonna measure the rise above that. So be familiar with the process, but you don't have to do it for part of the exam. Next, we're gonna auscultate and palpate the carotids.
Do you do them at the same time?